Have you heard about inflammatory depression? My name is Bliss Lewis, and I'm an integrative psychiatrist. And let's talk about inflammatory depression and also how to figure out if the type of depression someone has is the inflammatory subtype. So it's important because inflammation is a big deal, and there are things to do that can help treatment. Depression is not one size fits all condition. There are many subtypes, and we're just early in the scientific process of identifying the different subtypes. Maybe in another 20 years or 100 years, we won't just say depression. We'll say what kind of depression. So the subset that we're looking at now, and there's a lot of interest, there's a lot of research, is inflammatory depression. And this type of depression can be identified by checking for inflammation, checking the blood for inflammatory markers. The simplest one, the most popular one to get is CRP, or high sensitivity C-reactive protein. That's a marker that can be easily obtained from a regular lab. Let's think about inflammatory depression. It's a little different. It has a different profile of symptoms. And the symptoms there are three main categories: changes in sleep and appetite, significant disturbances there, fatigue, and three, lack of motivation. So kind of this low energy depression rather than like an agitated depression. And frequently, this type of depression comes together with health issues, such as overweight or obesity or blood sugar regulation issues. And not always, but sometimes if you have a patient who's also dealing with those issues, that might be significant to notice. So why is it important to think about inflammatory depression? So for starters, inflammatory depression tends to be more treatment resistant to treatment with typical antidepressants. And that means that medications may not work, the usual treatment plan may not work. It may help to explain why it's harder to get a certain person better, right? Or if you're struggling with this, why you're struggling with getting better. And it might be just as simple as getting the C-reactive protein levels checked. And that can be done by a physician, or now there are also websites where you can just order your own lab, and then you'll know if you have inflammatory depression. Like, why CRP specifically? Because it's inexpensive and easy, but there are a few other markers that can be checked. There's IL-6, there's a bunch of other types of markers that can be checked, but to keep it simple, start with just C-reactive protein. And it's important because if you know that there's a high level of inflammation and there's depression and maybe those symptoms that go with inflammatory depression, you have a clue for what's a root cause approach to treating that depression, to get yourself better or to get someone you're helping better, right? And that is addressing the inflammation, right? So rather than just like going to taking an antidepressant, which may not be as effective, it's thinking about what is driving inflammation for that specific individual and what can be done to lower the inflammation levels. And that's like a whole big other question I explore in other videos. But some things are simple. It might be changes in lifestyle. It might be identifying infections. It might be identifying some autoimmune condition or something like that that is driving that inflammation for that individual or for you. And if you know, oh, this might be causing inflammation, that's the thing to address, and that may actually help to feel better. It may work for mental health. So that's why it's important to know about inflammatory depression, and it's hopeful because it gives you another way to think about how to help someone or how to help yourself. And some of the ways to reduce inflammation are accessible and wonderful, right? It's just improving lifestyle. So thank you for listening. I hope this is useful.